How do you treat specific patients of color?
A lot of other clinics will just use a cheat sheet. When you buy a laser, there's a cheat sheet that's attached to it, and that says, okay, this patient has a type 5 Fitzpatrick skin color. You need to use a specific setting. But here at the Institute, we research and develop all of our own technology. So a lot of what I do when I decide is based on my examination. If I'm examining somebody and I see that there's a specific area that needs a higher energy or a different pulse duration, then I will change that on the laser. It's not a set protocol. The great thing about my lasers is that they're what we call unblinded. That makes the world of a difference. An unblinded laser means that the software isn't stopping me from actually changing all the parameters that I want to change. And that's how I get the best results.
So I'm going to be picky here.
Yeah.
A lot of clinics claim to do similar things. You're saying you make your own lasers. How many clinics do that?
What I can tell you is that it's probably very few. Our lasers are not white labeled. So some clinics will buy a laser from China or something like that, and then they'll label it with their name. But we actually research and develop all the tech here. So I work with an incredible biophysicist, Dr Paleka, who's here in clinic 4 days a week. Our lab is based in San Marino, and that's where we develop all of our technology. So all the lasers that you see in my clinic, and I have over 10 different lasers here, are actually produced in our lab there. So CE marked, FDA approved labs. What's really awesome is that we might take some parts from other places. So some of my hand pieces come from Korea, but the actual tech is specifically put together for the concerns that I want to address. For example, one of our lasers here, this is our Phantom Pico laser. I have 4 Pico lasers in my clinic, and most clinics will only have 1, right? They're expensive pieces of kit. I have 4 different lasers for 4 different concerns. And that's what's so great. We're able to engineer the lasers for specific things that we want, and we're still making new tech.